Hello again and welcome to the Comprehensive Course for Midwives. We are still on Section 4, Perinatal Mood and Anxiety Disorders. The second one of the three is childbirth-related mental health. In childbirth-related mental health disorders, we will talk about birth trauma, childbirth-related PTSD, risk factors, effects on the mother, effects on the baby, and options for treatment. So birth trauma is essentially post-traumatic stress associated with the childbirth experience. BTA, the Birth Trauma Association, defines birth trauma as a post-traumatic stress disorder that occurred from a childbirth experience, which includes the following two main elements: experiencing or witnessing an event involving actual or threatened danger to the self or others, and then responding with intense fear, helplessness, or horror. And this could be a perceived threat as well. So PTSD is an anxiety disorder, and postnatal or childbirth-related PTSD is a specific anxiety disorder when post-traumatic stress symptoms appear after a real or perceived trauma regarding childbirth, so before, during, or directly after childbirth, including labor. There are limited studies, unfortunately. There are more studies that have been done very recently, it's in the past 3 to 5 years, focusing on trauma, and childbirth trauma being now more accepted. But unfortunately, with the limited number of studies, there's also a limited understanding of the traumatic stress responses around childbirth. Some studies do suggest that PTSD is maintained through the individual's unhelpful cognitive and behavioral strategies. So that includes the suppression, the numbing, the reminder avoidance, and rumination. If a birthing individual and or her partner perceive birth as traumatic, then it can result in ongoing emotional distress. This could be birth trauma, this could be PTSD, again, depending on the extent of the trauma and the symptoms that are involved. The term birth trauma itself does lack universal acceptance or a standard definition. Generally, it is accepted that it is a PTSD or PTSS, which is post-traumatic stress disorder or stress symptoms. Most mental health professionals, they use the terms either PTSD, CB for childbirth, or stress-related childbirth trauma. Now, these are symptoms of PTSD. They can also be symptoms of birth-related PTSD. They're generally accepted as signs and symptoms. So again, it's the symptoms is what the individual is feeling. The signs is what you can see externally, such as the flashbacks to the experience. This would be a symptom. The experience of the nightmares about the experience, flashbacks or nightmares. So feeling as though they're reliving the trauma, reliving the pain of being in the hospital or the cesarean section or the baby in the NICU or whatever the particular experience is that led to that trauma. Repetitive and distressing images or sensations that are arriving visually or feeling of the individual regarding the particular experience. Physical sensations like pain, sweating, feeling sick or trembling, nausea often if somebody's thinking about something that is a fearful or traumatic memory, trembling, increased heart rate, increased breathing, tachypnea or tachycardia, depending on the specific individual. Constant negative thoughts about the experience, that does tend to happen a lot with both birth-related trauma and general PTSD. Trying to feel nothing at all, emotional numbing, as explained in the last slide, is sometimes a coping mechanism. Trying to distract yourself or avoid thinking about what happened, again, as a coping mechanism, avoidance is often used. as well as avoiding places, people, or other things that remind you of the traumatic event. So this is, again, a typical PTSD sign, but with birth-related, it occurs often not thinking about the hospital, not wanting to hear the word hospital, or the hospital itself, not wanting to hear, saying such and such, or such and such medical center. Sometimes that giving like a guttural nodular response. Also, not talking about it, that could be of the avoiding as well, avoiding the thoughts and the numbing and the emotional numbing about the experience, not wanting to talk about the birth. Some of the top risk factors, we'll go over more detail in the next slide, but the big ones are maternal medical emergency, lack of pain management or physical support, not feeling emotionally safe, feeling unseen or unheard, and the baby being at medical risk. Now that could be prior to birth, or that could be after the birth, finding that the baby needs to go to the NICU, as we'll see more in the next slide. Some more risk factors include low levels of perceived safety during birth, where a birthing mother feels as though she's in a situation that is not safe for her or the baby. As noted in the last slide, yes, if the baby has to go to the NICU, if the baby is suffering from a medical issue or injury, or there's a scare that the cord is wrapped around the neck, or the baby is not breathing, or the baby is at risk for meconium aspiration. I mean, there's so many things that could happen at the birth itself that give the mother feelings of lack of safety, additional fear, and additional trauma. Now, just as we talked about in protective factors, having that social support is a significant influence, and it could be a risk factor in birth trauma. So both low levels of partner support during birth and low or lack of social interaction and lack of social support is a factor in increasing the risk of trauma. The use of instruments to assist vaginal delivery, so forceps, vacuum extraction, anything that is different than the mother perceived as going calmly, smoothly, and well, such as any sort of medical interventions when she was expecting none, sometimes could put her in the mindset of involving trauma, especially if they're more painful for herself or for the baby. Negative cognitions about the self, the individual who's birthing in relation to the birth. I can't do it, I'm not good enough, my body's not good enough, we need to use forceps because my body can't birth a baby without help, etc., etc. These are the negative thoughts about self. Even though it has nothing to do, obviously, and the mother is not at fault, but she may feel she is at fault, which again could lead to significant trauma. A history of sexual abuse or sexual assault is definitely something that may come up again. It's like a reemerging trauma that comes sometimes during birth. Anxiety sensitivity, so that isn't just the anxiety itself. Anxiety sensitivity is one's belief that the anxiety experiences will have negative implications. And then finally, severe physical complications from birth. So hemorrhaging, hysterectomy, perineal tearing. We'll talk about tears of the perineum the upcoming slides with an example of somebody that it's happened to and has had severe birth trauma. Also something like a placenta accreta or placenta previa can be a significant issue that causes physical complications. So Alana was my maid of honor, and she was brave enough to share her story with Danielle Yeager's YouTube channel called Discussion of Birth. She had a very intense birth, and she had a tearing, and it's been something that's haunting her continually for the past several years, 2 years, actually, as of last week. Her little one now is 2, and she has been brave enough to share it with others, and I believe that women such as Alana that are able to open up and normalize and support and take this out of the closet, and take birth trauma, take the stigma away from talking about birth and related mental health issues is extremely important to all mothers. She said birth trauma comes in many forms, and talking about it needs to be normalized. 2 years ago, and that was, again, her baby was just turned 2, she posted a picture, she said, of my pizza baby bump alongside a box of Krispy Kreme donuts with the caption, "Don't worry guys, my sugars are fine." Little did I know that in a few short weeks we'd be meeting our baby in an extremely traumatic way that none of us could have predicted. A few weeks ago, I had the privilege of sitting down with Danielle Yeager and recording a series of videos for her YouTube channel Discussion of Birth about what happened when Evan was born. So this is, if anybody has time to look through the YouTube channel Discussion of Birth, there are so many helpful feedbacks from real mothers experiencing real pain, and there's a lot that we can learn from them, even more so than in any book or class or conference, because we get to see that perspective, the perspective coming from the mother experiencing the trauma. Birth comes with risks. We might all know that, or we might have heard that, but do we actually know what those risks are? Most people will talk about the risks of C-sections and say it's surgery, so it comes with risks, but most of us don't know that anything can happen with, don't know anything about what could happen with vaginal births and what can and does happen more often than we think. And this is extremely important. I'm going to stop the quote for a second from Danielle, because again, one of the most important things is hearing from the patient's perspective. There may be so many things that we know and that we were taught in medical school or nursing school or midwifery school about what potentially could happen. And I know we don't want to scare the mothers, but at the same time, they don't often know. And sometimes without that preparation, without that psychoeducation, because a lot of the mental health issues are comorbid with physical birth issues, and the fact that they both occur and the physical issues are talked about and the mental health issues are often ignored or not discussed or brushed under the carpet, that can cause a lot more issues of not accepting, not realizing, not understanding, and not being able to accept or heal because of the lack of knowledge and, health education, that health literacy aspect of it. So again, as Danielle said, many of us don't know about the risks. Most of us don't know anything about vaginal birth risks and what can and does happen more often than we think. A huge risk to vaginal birth is tears. A lot of us end up tearing, and the worst one is called a 4th-degree tear. Here is the story of Alana, a first-time mother who experienced a 4th-degree tear. And again, here is the link below if anybody is interested. But just knowing, learning about the tears that could happen from a clinical perspective is wonderful, but it is not all that's needed. We also have to hear it from the mother's perspective, the patient's perspective, and also take into consideration with mental health, because it's not just physical. Everything about birth is not just physical. It's biopsychosocial. There are so many elements. You'll see this great picture here with Evan that was taken on the day of his birth on the top, and then the bottom one here with happy mommy and son, just taken last week. And so they are healing, and it's wonderful to know that with support, with understanding, and with acceptance, we are able to heal. Alana says, I was going back and forth about posting this and finally decided to, because we really need to normalize talking about trauma, whether it's related to birth or something else. And if you experience trauma, your feelings are valid, and I see you. Reach out to your doctor. If you're having a hard time coping and you think you might need to, don't suffer in silence. Reach out. This is extremely important because so many people, they feel this. They feel lost and scared and confused. They feel guilt and pain and anger. Often because of, you see in the pink is the unhelpful comments. And a lot of times people don't know what to say, including healthcare practitioners. Unfortunately, there is a large amount of nurses, doctors, and midwives. I've heard feedback from patients and friends that they hear, well, at least you survived. I'm glad you'll be okay. Hey, at least the baby's okay. Hey, you had a natural birth, or you still were able to get through it. Good for you. Again, just not the promoting positive is good, but not when you overshadow what happened, their experience, that not when you don't validate their feelings and validate the intense experience that they've gone through. So that's something that everybody on every level of working with women having babies needs to know. Now, earlier in this slideshow, we had said that an event may be actual, the physical trauma can also be perceived as traumatic. So if it's perceived as traumatic, then there's also a chance that a woman will have birth-related PTSD. And event is more likely to be perceived as traumatic when it comes unexpectedly, when it's out of your control, when you feel as though you're not able to prevent it, when you're intensely emotional because of it, when you may not be able to stop thinking about it, and when you're or when you are unable to remember the event itself, if your brain blocked it out because of the intense trauma, that is more likely to have a post-traumatic stress involvement and experience, including those signs and symptoms and potentially the clinical diagnosis itself. This quote comes directly from a Beck study that's posted again in the end of this presentation under references. It's a wonderful study. I would suggest reading the whole study. It's quite old, almost 20 years, but has a lot of very valid points on emotional involvement, psychological trauma, and going through the birth process. Mothers with post-traumatic stress disorder attributable to childbirth struggle to survive each day while battling terrifying nightmares and flashbacks of the birth, anger, anxiety, depression, and painful isolation from the world of motherhood. With therapy and treatment, and we will talk about that later in the treatment slide, but they are able to heal. But a lot of these effects, especially the guilt, these will often occur within the first couple of days to couple of weeks after birth, with that 2-week time period past the baby blues, potentially falling into postpartum depression, especially with the self-blame and the guilt, feeling responsible for what happened. There's also an increased physical illness in a lot of these women, including excessive fatigue, vital exhaustion, and reduction in functional capacity. You can't really function as well. The quality of life decreases because there are complications, physical and emotional complications that stop you from going to work or from having relationships. Hence the next bullet here, impaired familiar and social relationships. And finally, the last bullet is profound grief, intense and long-lasting grief from the situation itself. It's almost like a bereavement of a loss, but there's not a death involved, but it's still a grief and loss of the birth experience. Some studies also show that negative birth experience is related to a reduced probability of having a subsequent child. Many women, a lot, especially those who have had this as a first baby and had this as their only birth experience, tend to choose not to have another baby. And this is statistically valid for first births as well as multiple, or subsequent births. So for example, if somebody has had another baby and then had a traumatic birth, they may choose not to have a third after having that negative trauma experience. The effects on the baby can also be both short and long-term. Difficulty with bonding and attachment. Unfortunately, this comes up a lot with the initial few weeks of delays in breastfeeding and latching, delays in making eye contact, inability to focus. Further on, we could see increased risk of aggression and anxiety as the children get older. Back to newborn, there are delays in sucking of more than 24 to 48 hours. There's also vomiting, spitting up after feeding, and additional gastrointestinal issues that these babies tend to have. And then spells of inconsolable crying. That does seem to be one of the top effects on a baby whose mother has gone through trauma. Trauma may also interfere with the oxytocin release that normally occurs in the immediate postpartum period, and that could interfere not only with the mother bonding with the baby, but then also with her breastfeeding. As of now, the FDA has only approved 2 antidepressants for treatment for PTSD, but again, PTSD and trauma are not always helped by anti-anxiety or antidepressant medications. It really depends on the signs and symptoms. Plus the fact that birth PTSD, birth trauma, is highly comorbid with other mental health issues, often depression or something that the mother has been diagnosed with previously. So if an individual is already on a antidepressant or an anti-anxiety medication, then a psychiatrist or physician may decide to add an additional medication or may use a specific anti-anxiety med off-label to help treat the signs and symptoms of the PTSD. Most helpful has been CBT, CPT, and EMDR. EMDR is eye movement desensitization and reprocessing. So this is really, EMDR is really based in the adaptive information processing model. So that is focused on mental health disorders being maladaptively stored memories of an earlier adverse life experience, and specifically in this situation, it would be that birth trauma. So focusing on that, resolving those experiences, it targets the triggers that one currently has and helps to build resiliency, trauma resiliency. Trauma-focused CBT therapy and interventions that support women to reduce negative cognitions of their self in relation to birth. So again, that rewriting the narrative essentially. Making sure that the CBT is something that is appropriate, and again, working with a therapist who has done this before. And then cognitive processing therapy was actually used a lot for PTSD. Again, a trauma-focused psychotherapy. It is shown to be very effective in resolving trauma in multiple studies. So patients that have complicated presentations, again, as I mentioned, the comorbidity for patients that have a comorbid personality disorder or a depression or anxiety that had occurred previously or co-occurring, that cognitive processing therapy is great to deal with that. It's essentially the challenge and change model. So you challenge and modify those beliefs, the unhelpful beliefs that are related to the trauma. You find them, identify them, and then address this unhelpful thinking pattern. which actually kind of falls into the next bullet, providing alternative responses to negative thought intrusions. So this really done through these types of therapies is extremely helpful. And then social support, of course, we know that's a huge protective factor, but especially with trauma, social support is huge, birth trauma, because there's a lot of stigma, not only related to mental health issues, but then on top of it, people want to focus on birth being positive and saying, hey, at least your baby's okay. And unfortunately, that pushes the mother sometimes in the dark, in the shadows. So increasing that support can help significantly. And finally, using meditations or self-talk for changing disturbing thought patterns. So again, you see a lot of these treatments that we were talking about are really focused on, challenging and modifying that behavior, that thought process that's connected to that trauma. With meditation, I also want to add mindfulness. So mindfulness, we know, can help in a lot of areas, but especially when somebody is starting to have intrusive thoughts that flash back to the negative birth experience, that sometimes using this purposeful awareness of the present moment and grounding can help to provide self-empowerment and self-mastery. Again, here are the references that I referred to earlier. I've also included some of the studies that I referred